Hi, I'm Amy Stasiewicz, and welcome to The Minutes. Thanks for listening today. It's great to have you along on The Minutes this week. This is a City of Thunder Bay podcast. The Minutes takes a look at what happened at Thunder Bay City Council and Standing Committee meetings. But this week, we have a special edition of the show, where we'll be chatting about the city's drug strategy. You can find The Minutes wherever you get your podcasts, including our YouTube channel and our website, thunderbay.ca/theminutes. If you want to keep your finger on the pulse of what's happening at City Hall, hit that subscribe button. Soon, I'll be joined by Rachel Globensky, the city's drug strategy specialist, to talk about the work being done to address substance use and support a healthier and safer Thunder Bay. Today, we're speaking with Rachel Globensky, the city's drug strategy specialist. Rachel is here to help us better understand the important work being done through Thunder Bay's drug strategy and what it means for our community. We'll discuss current priorities, partnerships, and the ongoing efforts to support health and well-being across the city. Hi, Rachel. Thanks for joining me today.
Hi, Amy. Thanks for having me.
Okay, so to start off, maybe you could just tell us a bit about yourself, your background, and then how you kind of got into this role.
Sure, of course. So I have a bit of a varied background. I've definitely taken some unexpected turns. I have a geography and forestry background. I also did my chef training and some studies of nutrition and food service management. And then I did a Master of Health Science. And I guess a common thread through all of that would be community work, health, and helping people. So I've done lots of community development roles, connecting people, building relationships, and finding practical solutions to complex issues. That's kind of my jam. And that led me here. I also grew up in Nullaloo and have spent a lot of my time in Thunder Bay, so doing this work here means a lot to me.
Yeah, that's amazing. Yeah, quite the background. What interested you most about becoming the drug strategy specialist with the city?
So this role brings together public health, community partnerships, and working to improve systems so they work better for people, which I've done a lot of and I really like. Substance use doesn't exist on its own, and there's a lot of connection to housing, poverty, trauma, mental health, public safety, and access to care. And this role really looks at the whole picture of that. And I like the connection piece of this role too. So, no one organization can solve these issues on its own. Yeah. And a big part of it is helping people to work together. And because I'm from this area and substance use touches so many people, the work feels really personal. I care a lot about our community and how people are supported.
Yeah, that's amazing. You're doing great work. So we're talking about the drug strategy a lot. Can you just explain to people what that is if they aren't even really sure what that is?
Right, sure. So I guess the heart of the drug strategy is community partnerships. So we have organizations from healthcare, housing, public health, treatment services, harm reduction, policing, Indigenous-led organizations, social services, education, and many other sectors as well. And as the city, we don't provide treatment or direct services through the drug strategy. So my role is to coordinate and help other organizations stay connected, identify shared priorities and challenges, and work together more effectively to help people in our city. Yeah. So we look at local data, which I love as a data nerd. We support community projects, events. We work to reduce stigma, which is a big thing right now. And I try to make sure that the work happening across Thunder Bay is as coordinated and relevant as possible. Yeah. And these are really complex issues, and we can definitely accomplish more when we work together.
Yeah, 100%. The drug strategy is built around 5 pillars. So can you give us just an overview of what those pillars are and why they're important?
Yeah, sure. So we have 5 pillars. They are prevention, treatment, harm reduction, enforcement, and housing. And each one looks at a different piece of the overall puzzle. So prevention and education is really reducing the risk before people experience serious harms. Treatment includes services and supports that help people address substance use and work towards recovery, whatever that looks like for them. Harm reduction keeps people safe, alive, and connected to care. Enforcement addresses public safety and illegal drug activity. And housing is included because it's incredibly difficult to focus on health or recovery when you don't have a safe or a stable place to live.
Yeah.
And like the other work, none of the pillars work on its own. People's lives are complex. And so we need all 5 of these working together to respond in a meaningful way.
Yeah. So this kind of goes into my next question. Why is it important to address substance use through multiple approaches rather than just one basic solution?
That's a good question. So there isn't one reason that people use substances. So it just makes you think that there wouldn't be one solution that would work for everybody. Yeah. So people's needs are different, and these needs can change over time. Someone might need housing first, someone else might need treatment or mental health support or harm reduction, or they might just need help meeting their basic needs before they're ready for the next step, whatever that is for them. So that's why having multiple pathways into care is really important. And the more connected the services are, the easier it is for people to get support without falling through the cracks.
Yeah.
And it's, again, meeting people where they're at instead of expecting people to follow a path or, a certain timeline. Yeah,
totally. You mentioned like local partners and organizations that you work with. So how do you collaborate with these groups typically?
Yeah, so we spend some time meeting with different organizations from the different sectors. We talk about what we're seeing, what's changing in the community, where these services are feeling pressure, where there's opportunities to work together. Mm-hmm. So I also coordinate the drug strategy implementation panel, as I mentioned before, and connect with other existing community tables. There's lots of good work happening in Thunder Bay, so I don't want to create another committee when the right people are already meeting.
Yeah.
And sometimes the best thing to do is connect people or organizations that may not know about each other, that should be talking to one another. And for that, we need trust and relationships and recognizing that everybody brings a different perspective and different experience to the table.
Yeah, for sure. Obviously, this is probably always evolving, but how many organizations are involved in the drug strategy work?
So there are really dozens of organizations involved, although it's hard to put like an exact number on it because everybody contributes in different ways. So some partners are part of the implementation panels. Others are involved through different working groups or community projects or events. There's data sharing. There's specific projects. It's really like a broad network, locally, provincially, and nationally. And right now, actually, one of my projects is sort of mapping out our network so we have a clearer picture of who's involved, how everybody connects, and where we can strengthen those relationships, and if there's anybody missing.
Right, for sure. What would you say are some of the biggest strengths of Thunder Bay's response to substance use?
So I think one of our biggest strengths is the people. We have so many organizations and individuals who really care about this work and understand our community. There's also a really strong culture of collaboration here in our big, small town.
Yeah.
Partners want to share information. They want to support each other and work together when new challenges come up. Thunder Bay is a unique place, and I think that the willingness to work together in Thunder Bay is something that we do really well.
Yeah, you all have a common goal.
Yeah, absolutely.
Yeah. Okay, so what are some gaps or challenges, and I'm sure there's a few, that community partners are facing?
So housing comes up over and over again. It's incredibly difficult to focus on treatment, health, or recovery when you don't have, somewhere safe to live.
Yeah.
Partners also talk about timely access to treatment and mental health services, supportive housing, transportation, culturally safe care, and longer-term recovery supports. Mm-hmm. And the system can be really hard to navigate, especially when someone is dealing with several things all at once. And organizations are stretched pretty thin.
Yeah.
They're working with limited resources and supporting people with increasingly complex needs too.
Yeah.
And stigma. Stigma makes it really hard for people to reach out and get the support that they need.
Yeah, for sure. That's a everywhere problem, but yeah, it sounds like there's some great people working on all of this. Yeah. Okay, so Thunder Bay experiences rates of toxic drug poisonings that are significantly higher than provincial and national averages. What are some factors that are contributing to this?
Yeah, so it's kind of important to look at it from a few different angles and not to oversimplify it. There's not really one singular reason.
Right.
It's definitely a combination of factors that all interact with each other. So firstly, we have an increasingly toxic and unpredictable, unregulated drug supply coming into the city.
Yeah.
We also have challenges related to housing, poverty, trauma, mental health, access to care in the north, and transportation as well. Thunder Bay is also a regional hub, so we're seeing people from across northwestern Ontario, including people who have had limited access to services in their home communities, come to Thunder Bay. And then when you add on ongoing impacts of colonialism, racism, intergenerational trauma, and stigma, like it's such a huge and painful issue. And again, like you can't really look at one piece without sort of seeing the whole picture.
Yeah, it's complex. You mentioned that Thunder Bay's a regional hub. So how does that influence the work of your position?
Yeah, so as I mentioned, Thunder Bay serves a much larger region than just the city itself. So people come from all across the province for healthcare, treatment, housing, education, court services, and many other supports. So that creates a bit of an added pressure on local services, and it can mean people are also far from their families, community, culture, and usual supports when they're here. And so I think having strong relationships with Indigenous communities, regional organizations, health partners, and different levels of government are really important, because what happens in Thunder Bay affects the region, and what happens across the region, affects Thunder Bay.
Yeah, for sure. Thunder Bay is far from a lot of communities. Okay, so what are some trends or emerging issues you and the partners that you work with are watching right now?
So I would say probably the most important is the changing drug supply, which continues to be the biggest concern and challenge. It's constantly evolving. Partners are watching what substances are showing up locally and what that means for people's safety. We're also seeing more people dealing with substance use, mental health, physical health, trauma, and housing instability all at the same time. So it's kind of like the perfect storm.
Yeah.
And that level of complexity really puts pressure on people and the organizations trying to support them too. So we're also paying close attention to service capacity, emergency department pressures, wait time, youth prevention, and changes at the provincial and national levels that might affect our community as well.
Yeah, for sure. It's complicated.
Lots going on.
It's complicated, yeah. How has substance use challenges changed over the past several years? I feel like you've talked about this, but maybe you have some more points.
Sure. So I think the biggest challenge has just been how toxic and unpredictable the unregulated drug supply has become.
Yeah.
The risks are so much higher than they were even just a few years ago. We've also seen like the rolling effects of the pandemic.
Yeah.
Like housing shortages, increasing homelessness, adding more and more pressure to both people and the organizations supporting them. One positive change is that more people are starting to understand substance use as something connected to health and trauma and housing and social conditions rather than simply an individual issue or a bad choice.
Yeah.
We still have a lot of work to do around stigma, but the conversation has started to shift and more people are talking about it, which is definitely good.
Oh, 100%. Like, I feel like it comes up in like just even in events that you're seeing around town, like it's more talked about.
Yeah, and just recognizing that, behind all of these statistics or what have you, it's a person. It's someone who's, somebody's daughter or mom or uncle or brother. Like, these are people.
Yeah.
So.
Oh, 100%. Okay, so many people hear the term harm reduction, but may not fully understand it. So what does harm reduction mean just in your terms?
So harm reduction is really just anything we do to reduce the chance of harm. So we use harm reduction every day, like we put a seatbelt on, and that reduces the chance of serious injury in a car accident, or we put a bike helmet on, and that helps reduce the chance of a head injury.
Yeah.
So it doesn't remove every risk, but it makes an activity safer.
Okay.
So the same idea can be applied to substance use as well. So harm reduction focuses on practical ways to reduce risk and help keep people safe. So this includes naloxone, safer use supplies, drug checking, overdose prevention, education as well. Also means meeting people where they're at and treating them with dignity, recognizing that they don't have to necessarily stop using substances before they deserve care or support.
Yeah.
Like that's a really big one.
Yeah.
Harm reduction can also mean helping someone connect with housing and healthcare and food and treatment and other services as well.
Yeah.
It's about, keeping people alive and reducing the harms to themselves or other people and creating opportunities for people to access the support that they need on their timeline.
Yeah, for sure. And how does harm reduction fit alongside things like prevention, treatment, recovery, enforcement efforts? You kind of touched on that, but
Yeah, and like everything else, it's not separate from the other pillars, but definitely sort of works along with all of them. It helps to address somebody's immediate safety, while prevention, treatment, recovery, and enforcement sort of have their own part to play as well. So for some people, harm reduction is the first point of connection. They may meet a street outreach worker who provides safer use supplies, naloxone, or basic care or necessities.
Yeah.
And over time, that trusted relationship can lead to maybe that person seeking treatment or asking about housing options or different health care for other needs that they might have. And the goal of all these services is to really connect people so they're not left trying to navigate the systems on their own.
Yeah. Oh, I can't imagine. So what are some common misconceptions people have about substance use and addiction?
So probably one of the biggest misconceptions is that substance use is about making bad choices. And really, it's influenced by so many factors like we've talked about, trauma, mental health, pain, genetics, housing, poverty, and just life experiences.
Yeah.
Another misconception is that someone has to hit rock bottom before they deserve help, which is absolutely not true. I don't think we should be waiting until someone is in the worst moment of their life before we, extend a hand and offer support.
Yeah.
People also think that harm reduction encourages substance use when really it's about reducing risk and helping people stay connected to care and other people, which is also really important.
Yeah.
And recovery isn't one size fits all. It looks different for everyone, and substance use is only one part of somebody's story.
Yeah, for sure. And like you said, everyone's background is different. Everyone is dealing with like any of us,
multiple
but
things.
100%.
Yeah.
So I feel like this is obvious, but why is reducing stigma such an important part of this work?
So I think stigma can be one of the biggest barriers to getting help. When people are afraid of being judged or treated differently, they're definitely much less likely to reach out for help or care. People may feel that they have to keep what they have going on to themselves because they're worried about how others respond. Maybe they're embarrassed. Maybe they're, afraid that they're going to be judged or people will look at them differently, their families or their coworkers or whoever it is. And stigma can increase risk too. So if somebody uses substances alone because they're afraid of being seen or judged, that really increases the chance of a fatal poisoning, which is really awful too.
Yeah, that's awful. And the stigma is even if you're not the user, but say you your family knows, but then, they don't want anyone to know, and just like a ripple
it under the rug. Right?
Yeah.
Reducing stigma is about more than just being kind. It sort of shifts some of the blame and shame, takes it out of the equation, and just allows us to respond to substance use as a health and a community issue.
So right now, I believe the drug strategy is being refreshed. Can you tell us a bit about that process?
Yeah, so we're in the very early stages.
Okay.
So like I was talking about earlier, right now I'm spending a lot of time understanding what's been done already, what's changed, and what we've learned since the last strategy. So again, we're reviewing local data, reconnecting the different implementation panel and working group people, talking with partners across the community. And the next step is broader engagement with organizations and community members, but probably most importantly is people with lived and living experience to help shape the priorities.
Yeah.
I want the new strategy to be practical and useful, like a living document with clear actions and accountability that gets revisited, not just something that just gets written and then collects dust on a shelf somewhere.
Right, for sure. And that happens. And what kind of opportunities are there for community members and organizations to contribute to this next phase?
Yeah, so again, collaboration is super key here. So just figuring out how exactly that will work, but community members will be involved through the implementation panel. Some people, put on their hat of executive director. Some people put on their hat of, concerned parent or neighbor or something like that too. That happens through our working groups, different consultations with community members, and other opportunities as we move forward. And as I talked about, it's really important to us that the people with lived and living experience be involved at every step of the way, not just ask for feedback once the big decisions have been made. And my hope is that people see their ideas and their expertise and their experiences reflected in the strategy. I think that involvement will make the strategy a lot stronger.
Yeah, for sure. When you're thinking about the future, what are some hopes for people and communities affected by substance use in Thunder Bay?
So I have a big wish list for this.
Yeah, I know. It's a loaded question for you, yeah.
I hope that people get the help they need when they need it, without having to wait until they're in crisis.
Yeah.
I would like to see services become easier to find, access, and navigate. People should not have to know exactly which door to knock on or have to tell their story over and over again to get support. I hope people have access to safe housing, culturally appropriate care, treatment, harm reduction, and recovery supports that are dignified and that reflect what they need at that point in their lives. I hope families feel supported and that they don't have to figure out everything on their own with everything else going on for them.
Yeah.
And more than anything, I really hope that we continue to build a community where people are treated with dignity and compassion and respect. And this one strategy won't solve everything, but it can help us to strengthen the relationships, improve coordination, and make it easier for people to get the right support.
Yeah, for sure. Well, You're headed in the right direction. Okay, so to finish off, we obviously covered a lot, but is there anything else you want to remind people of or inform them about that we didn't cover today?
Yeah, so I think the biggest thing I would leave people with is that substance use can affect anyone. It's not limited to a specific neighborhood or one group of people. It can really affect anyone. Behind every statistic is a person, like we just mentioned, along with family members, friends, coworkers, and other people who care about them. And again, this isn't something one organization or one strategy can solve on its own. It takes, a village of service providers, governments, organizations, community members working together. And I also want people to remember that recovery is possible and it can look different for everybody. We all have a role to play, and that might mean learning how to use naloxone or using respectful language, challenging stigma when you come across it in the community, or just even checking in on someone who may be struggling. And these actions might feel small, but they definitely help create a safer and more supportive community.
Yeah, 100%. Oh my gosh. Well, that's a wrap. This was a great combo. A big thanks to you for helping so many Thunder Bay community members through all the important work you're doing. And thanks for coming to chat with me today.
Thanks a lot, Amy.
That's it for this week's episode of The Minutes. A big thank you to Rachel Globensky, the city's drug strategy specialist, for joining us. You can catch The Minutes every week wherever you get your podcasts, on our YouTube channel or on our website, thunderbay.ca/The Minutes. If you haven't already, hit that subscribe button so you never miss an update. I'm Amy. Thanks again for listening to The Minutes and have a great week.